Hello, I'm Brian O'Mahony, and I served as President of the World Federation of Hemophilia from 1994 to 2004. WFH was founded on June 25, 1963, at a meeting of representatives of 12 countries in Copenhagen, Denmark. The original goal of the organisation was to bring people together, to share knowledge, to improve care across the world. This was initially carried out by organising global scientific congresses dedicated to haemophilia and bleeding disorders. Looking back to the early proceedings of these congresses, we see some of the then leading names in haemophilia: Kenneth Brinkhaus, Margarita Blomberg, Inga Marie Nielsen, and many others. In 1969, thanks largely to the efforts of Henri Chagnot from France, the WHO acknowledged WFH's growing international reputation and established official relations with WFH. In the 1970s, WFH began thinking about how to improve care globally. Peter Levine worked on the definition of comprehensive care centres, while Anthony Britton and Pierre Minucci developed the idea of a network of international haemophilia training centres, or IHTCs. This was the first development programme of the WFH to proactively improve care in developing and emerging countries by providing training fellowships for healthcare workers and providing workshops. I attended my first WFH conference in Brazil in 1984, and in fact at that conference I had the pleasure of meeting Frank and Martha Schnabel. The conference and attending that conference greatly broadened my horizons. The fact that I had the chance to meet people with haemophilia from so many countries around the world. Of course I knew intellectually that there were people with haemophilia in every country, but it's an entirely different experience to be viscerally faced with the absolute difference in levels of access to care and what that does to quality of life. And I think emotionally, I had a major response to meeting people with haemophilia from so many countries, and I think I would put down my commitment to haemophilia to that Congress at that time. The tragedy of HIV and AIDS hit the community in 1983, and WFH responded by providing information and support via the World Hemophilia AIDS Centre and the work of Dr. Shelby Dietrich and Dr. Bruce Evett. For many of us who lost so many friends and colleagues throughout this tragic time, it redoubled our determination to make the world a better and a safer place for people with haemophilia. Charles Carman from the USA became WFH President in 1988, and under his leadership, WFH undertook a major strategic planning exercise to identify global needs and develop strategies to meet those needs. The document which emerged from this process, the Decade Plan, set the direction for the development of WFH as being goal and objective oriented. Now, as part of that Decade Plan process, I first got involved in the WFH, and I had been asked to identify if there were any changes required in the structure and governance of the organisation. And when I became President in 1994, we changed the governance structure, we brought in a new constitution, we unified the then executive and separate council into one body. And the effect of this was it led to a full mobilisation and utilisation of the talents, the skills and the enthusiasm of our many existing medical and lay expert volunteers. And the new development programmes we embarked on attracted many additional expert medical and lay volunteers. Together with the hiring of an excellent professional staff team, led by Lynn Robillard as Executive Director, the strategic objectives started to be implemented. The range and number of publications was greatly expanded to include monographs and the journal Hemophilia. From the initial information clearinghouse run by the WFH in Heidelberg, Germany, by Professor Klaus Schimpf, which collected data from a small number of countries annually, data collection was streamlined and improved to become annual global data collection. Attendance at the WFH congresses grew substantially, and the global safety and supply forums focused the discussion and work in this vital area. The key goal of WFH was the provision of care in developing and emerging countries. Development programmes were greatly expanded, and they included the development of twinning programmes between haemophilia treatment centres, twinning programmes between national patient organisations and chapters, laboratory wet workshops, humanitarian aid with factor concentrates, and specific country programmes such as Operation Access, which we piloted in Chile and Uruguay. And these programmes worked on several elements of improving care nationally. So we went from programs looking at one element to programs using several elements within a particular country. And all of these programs placed the organisation and all of our volunteers and staff on a steep learning curve. And what became obvious to us was the growing importance of coalition building and the importance of government involvement if improved care was to be sustained. It became clear to us that despite the enthusiasm and expertise of the medical volunteers, the doctors, the healthcare workers, the haemophilia societies, if you did not have government commitment to haemophilia care in a country, you did not have sustainable haemophilia care in the long term. At the same time, while implementing our programmes and activities, we interacted with the haemophilia communities in the countries where we worked and in the countries where we visited. And we were always acutely aware that we were not just talking about systems and strategies, but people and people's lives. Each individual had a story, each individual had a value and a reality that they had to live with. We visited these two brothers in Mumbai. They were living in a two-room house. The family's income was very low. The father had died. The mother was struggling financially. The boys both had a lot of joint damage, particularly to their knees, and they could rarely attend school. They had very little stimulation in the home. Their best hope of improvement lay in physiotherapy or perhaps access to surgery, but the required factor concentrate that they would have required for this, they did not have access to at that time. And unfortunately, this story was not atypical. In our work, we had to bear this in mind, and the suffering or death of any adult or any child with haemophilia through lack of access to treatment diminishes all of us. At the same time, working with governments to provide treatment and improve the lives of people with haemophilia ennobles all of us. The key element in working together was coalition building. Coalition building with clinicians, with patient organisations, with industry was carried out, including planned donation for the first time of factor concentrates to complement country development programmes. This helped to make the provision of haemophilia care more attractive to governments. And the objective, of course, was to ensure government commitment to sustainable haemophilia care. All of these learnings and all of these elements that we developed, from twinning to training to patient organisation training to humanitarian aid, laboratory diagnosis, were then brought together in a concerted and ambitious 10-year approach to development, which we call the GAP programme, the Global Alliance for Progress. This programme aimed to provide the basis for sustainable care and government commitment, leading to a closing of the gap between the grim reality in many countries and the possibility of a better future. This father from Pakistan brought his child over mountain roads on a shaky bus in a journey taking several hours to get treatment for his child who had a bleed under his eye and also in his arm, and also because he heard that we were coming to Peshawar with a cure for haemophilia. Now, the child got treatment on that day, but we did not come with a cure for haemophilia. We do not yet have a cure for haemophilia, but we have, through our work together as a global community, I think we have a cure for isolation, we have a cure for lack of hope, we have a cure for despair. That cure is the World Federation of Haemophilia. Thank you.